Welcome to your Global Assessment 3 training module for Moody Health Center at Texas Chiropractic College. I'm Dr. Corey Mayo, the Director of Clinical Education, and I'll be leading your training module today. Throughout each student's clinic or trimester, they're required to complete 3 global assessments, a G1, a G2, and a G3. G3 is given in the last 5 weeks of the rotation. When you're assessing Global 3, you'll do it towards the end of the last 5 weeks. The data collection is focused on reasoning and overall growth of the intern. If you sit down to do a Global 3 with your intern, please access your assessment portal and fill out the assessment intro page. Select G3 and then assess the 5 data collection points, which we'll talk about in a second. Remember to make any notes that you discuss with the intern. An average is given of the 5 scored components for students to look at afterwards to see if they were below, at, or above benchmark for their clinic. Remember to give feedback. This is the overall performance of the intern for the entire semester, and it's the information that they will take with them into their next clinic. Here's a screenshot of the handout that you received. This is the questions and the meta-competencies tied to them. Here's a list of the individual meta-competencies. Let's go over the questions. Question number 1. You're going to evaluate the reasoning skills and diagnosis skills of the intern. Did the intern use clinical deductive reasoning skills? The next question is evaluating reasoning on their care plan. Did the intern create and administer a logical care plan? Next is literacy, or evidence-based care. What is the student's research ability, and do they use evidence-informed care? The next question is reflection and daily growth. Does the student challenge themselves daily and use self-evaluation skills? Last is their ethics and integrity. You're assessing their overall moral behavior throughout the rotation. Once you've assessed these 5 components, you move to the feedback page. You'll select G3, type the verbal feedback that you discussed with the student, what went well, and things to work on. And if clinical education review is required, you'll type in the parameters then. Type in your 4-letter verification code that only you and the clinic data manager know, and submit the survey. Let's see what it looks like. We'll start a new assessment. Select your name. Select the intern that you're evaluating. Choose the clinic that they're in. Since there's no chart number, you can type G3 or you can type NA. There's no case type, so select Other and put G3. Scroll down, select Global 3, and hit Next. Let's talk about each question. Diagnosis and reasoning. Student demonstrated deductive clinical reasoning when formulating diagnosis and differential diagnoses. All of these are graded on the Dreyfus model. Their care plan reasoning. Student demonstrated deductive clinical reasoning when treatment plan and following up, when developing a treatment plan. Literacy, evidence-based care. Student provided evidence-based, patient-centered care by presenting relevant literature and following current treatment guidelines. Reflection and daily growth. Student self-identified clinical strengths and weaknesses daily and challenged himself or herself to grow as a future healthcare provider. Ethics and integrity. Students maintained integrity and demonstrated ethical behavior. These are any notes that you discuss with a student. Let's say that care plans often developed are lengthy. So we'll click Care Plan, finish the assessment, select Next. Choose Global, talk about what went well, and then what to work on. Type in any clinical education review required, and then type in your verification code. You're finished with your assessment. This concludes your G3 training assessment module. For any questions, please refer to your handouts, the syllabi, and the clinic handbook. For questions and answers that can't be found in those, please refer to the following. For clinical operations questions, ask the Director of Clinical Services. For educational concerns, ask the Director of Clinical Education. And for resources, please ask the Clinic Data Manager. Thank you so much for your attention.